minimally invasive surgical procedures available in the Department of Interventional Radiology, which are done actually in a non-surgical way through a small pinhole in the body, in the skin, mainly done for the blood vessels of the body. So we'll talk about that today. These are the procedures done for almost any part of the body through a minimally invasive way, through a small hole in the skin, without any big cut, without any sutures usually. Through a small hole in the body, the treatment can be done for many parts of the body, many organs of the body. For example, you must have heard about the disease called as stroke. Stroke is a deadly, lethal disease. It can cause a loss of life, it can cause a paralysis, it can cause a complete vegetative condition of the body. What happens in the stroke is that there happens a block in the blood vessels of the brain. When the blood vessels of the brain blocks, the brain tissue starts dying and that part of the brain becomes incapacitated. Because of that, what happens, that person may have a paralysis, it can go into coma. If I tell you a particular signs which people can recognize, people may have a loss of balance while walking, suddenly they may lose the balance of walking, suddenly they may have difficulty in seeing, suddenly they may have a facial drooping, the face can go on one side, they may have a difficulty in talking, speaking, and they may have a difficulty in any other part of the functional of the body. So the stroke is one of the very lethal disease in the body, and because it happens from the block in the brain blood vessel, if the brain blood vessel block can be opened, the tissue can be saved in the brain and the person's life can be saved and the incapacitating condition can be prevented. In that, what is done is that interventional radiologist can go into the brain blood vessel through a small hole in the leg or in arm blood vessel and can go and take out the clot which is blocking the brain blood vessel. Sometimes it may need an angioplasty and stenting to open the brain blood vessel as well. But the brain tissue can be saved and the person's life can be saved if the person arrives in time. But remember, this is an emergency. Person need to reach the hospital as early as possible. If you see any sign of stroke in a person, do not delay, take the person to the hospital as early as possible. Another example, if I tell you, there can be some bleedings in the brain sometimes. That bleeding happens because of the weak point in the brain blood vessel. There can be some bulging in the brain blood vessel, which is called as aneurysm. Those are like bubble-like area, bulging-like area in the brain blood vessel, and because they have a weak point, they can rupture anytime because of the blood flow. And when they rupture, they can cause one of the most lethal, most dangerous kind of bleeding in the brain, which can take the person's life. In that condition, it is important to block that weak area of the brain blood vessel, and that is done through the help of interventional radiology as well. Earlier, we had only way of treating those was an open surgery, where the surgeon has to go and open the brain and then do the treatment for the weak area of the brain that is in the brain blood vessel, which is aneurysm. But nowadays, the same treatment can be done without opening the brain, without opening the skull. We can go to the small hole in the leg and then can do the treatment for that area without opening the body any other part and without any suture. Similarly, various treatments can be done for almost every part of the body, like in the legs. If there is any block in the blood vessel of the leg, can be treated. The various tumors can be treated. Various tumors may have a treatment to the interventional radiology, especially liver tumor, where the chemotherapy is given or radiotherapy is given, particularly in the tumor, without any side effect in the rest of the part of the body usually. This treatment, how this treatment started, I'll tell you a small story. There was a radiologist in America named Charles Theodore Dotter. He had a patient who was around 80-year-old lady. In 1964, on the day of 16 July particularly, he treated that lady. At that time, nobody could imagine that this kind of treatment can be done without opening the body in any way. But he was a visionary. He was a radiologist. So these treatments are done by the interventional radiology with the help of radiological imaging. Radiological imaging includes the ultrasound, CT scan, MRI, through which we see inside the body. And when we started seeing inside the body, we can start treating them as well. That was the idea which Charles Dotter had. So what he did was that the lady, 80-year-old lady, she had a bad ulcer in the leg, which was not healing because blood supply in the leg was less. and because blood supply in the leg was less, the ulcer was worsening and worsening. She was having severe pain, infection, and she was told that she has to get the leg cut, otherwise it will take her life. So she met Mr. Charles' daughter, Dr. Charles' daughter, and what he did was that he offered her that I will do the angiography of your of your leg. And during the angiography, he found there was a block in the leg blood vessel. And when he found the block in the leg blood vessel, he opened that blood vessel by using a small instrument without opening or cutting open that part of body through a small hole. That was the first treatment done through the intervention radiology with a minimally invasive way in the world.